we are focusing our presentation today on suicide awareness and prevention. So my name is Lauren. I am a clinical psychology doctoral student at George Mason. I work with my mentor is Dr. Christy Esposito Smithers, and I have worked with the Center for Community Mental Health at George Mason, the CCMH, in our outpatient clinic doing therapy and assessment and testing for youth, kids, teens, and adults as well. And I am currently in my 4th year of the program and have just started working at Children's National Medical Center in DC. And I'm working on the inpatient unit, working with kids for these first 6 months on the child psychiatric unit. And then I'll transfer to the other side where I'll be working on the adolescent psychiatric unit. And I will let Mallory introduce herself.
Yeah, thanks, Lauren. So I'm Mallory. I have basically the same resume as Lauren. I'm also a doctoral student at Mason, working at the Center for Community Mental Health, working with kids and families and adults. And also just recently started working at Children's National in their inpatient unit as well. The only difference is I'm on the adolescent side. So we just have different age groups, but we're really happy to be here and looking forward to being able to talk about, like we said, a really important topic of supporting teens when they need it most.
And Robin, if you wanted to introduce yourself really quickly.
Hi, I'm Dr. Robin Mellenbach. I'm the director for the George Mason Center for Community Mental Health and very proud of our advanced doctoral students who, really worked to put all the things that they've learned and then work with their advisors as well to share this presentation with you all. So, Lauren, I'll let you guys get started.
Okay, and we wanted to start off also with a welcome from Connor.
So my name's Mary. I sorry, threw him out there. Connor Boros is my nephew. Died by suicide 8 years ago, almost 8 years ago. And in my brother's passionate grief, he came up with this foundation in an effort to try and save another child from doing this and trying to save another family from going through what we had experienced. So the long and the short of the foundation is we are a very big resource in many different ways. My brother does, we do outreach to people. My brother takes phone calls of people in distress. He has taken phone calls from families who have children who are in distress. We also partner with other foundations who are like-minded in the same corner as us, and we try to raise funds and share our wealth to help other programs in their services as well.
Thank you so much, Mary, for sharing more about Connor Strong. And was there anything else, Katie, or did anyone else want to add anything else?
No, I think that's we're really glad that you guys are able to help us with this. One of our main goals at the foundation again is outreach and education, being able to help people realize that there is help out there, realize that there are resources that they might not know about. And just kind of that understanding that you're not alone in your struggle. You are not alone with having the feelings that you're feeling, and you're never alone in any type of situation because somebody's always been through it, right? So that's kind of what the purpose of these workshops was to help educate and help people feel like they can turn to someplace for help and support and have questions answered.
Thank you so much, Katie, for sharing that as well. And we are happy to be here and hope that this webinar will be helpful and informative for everybody. So first wanted to just explain a little bit more about where we're coming from George Mason at our Center for Community Mental Health. So this is an outpatient clinic where we work, and we have low cost and also free community mental health services. So that includes testing and therapy as well. So we provide comprehensive assessments as well as group therapy, individual therapy, family therapy, sometimes couples counseling as well. So we serve children, teens, adults, veterans. One of our services is that we also have kind of like a range, right, of starting out with a free emotional support line, both in English and Spanish. And then we have a brief program where we do short-term coping skill sessions. We also do community workshops, and then kind of going all the way up to the full individual therapy work. We want to highlight a couple groups that are starting this fall. So we have an Affirm group for LGBTQ plus teens that is getting started soon. We also have a parent skills training group for parents of elementary age children. And then we also have a DBT skills group for self-esteem. So that's focused on young adults ages 18 to 27. Our services are available generally in person or virtually. I'm not sure exactly if these groups are going to be in person or virtual. I know it can kind of differ by the group, but we do generally have sliding scale available for across all of our services as well, which is something that's really important to us to be able to provide affordable services based on need and income. And we have a couple links there, which we will leave when we share these slides so that people can take a look at more information in the video afterwards as well. Robin, was there anything else you wanted to add about CCMH? Okay, all right, we'll keep going because we got a lot of slides to get through. Okay, so we want to start off with asking some questions and kind of thinking about maybe some of our conceptions or misconceptions about suicide prevention. So first, fact or fiction, asking teens if they are thinking about killing themselves will plant the idea in their head. And people can answer in the chat or unmute if you'd like. We think this is fact or fiction. Yes, we have one response, fiction question mark. Yes, this is fiction. We have research showing that if we're asking kids about that, it's not planting the idea in their head, and it actually is something that's really important as part of our safety planning that we do as therapists with families. Is we ask the kids directly. We have the families ask the kids directly, and we'll talk more about that a little bit later as well. Next is that most teens who die by suicide have talked about it with someone. I think this is fact or fiction. So this one actually is fact. Of course, it's not true in all cases, right? Some teens don't talk about it, but most teens, a majority who have died by suicide, have talked about it with someone at some point. So that's, yeah, something important to keep in mind. Next, if teens really want to kill themselves, there's nothing that can be done. Fact or fiction? So this one is fiction, which is, yeah, something that is positive, absolutely, for us. That there are things that we know. There's research out there. There's evidence for treatments that can help kids who are experiencing thoughts of suicide or having those urges, and that's something that we can work on in therapy. There's a lot more that we'll discuss a little bit later about what that might look like and how to look for that support. Yes, thank you, Robin. This is an important one. Improvement in a suicidal teens means that the most dangerous time is past. Fact or fiction? Yes, we have a couple guesses. This one is also fiction, right? This is actually something we'll talk about more, as it is a warning sign to be aware of, is that when teens have potentially been depressed for a while and seemed really down and suddenly seem more cheerful, that can be a warning sign that they have actually made the decision to complete suicide or that they're planning to attempt suicide. And that improvement actually can be a warning sign that we want to make sure we're going to be aware of as well. Next is the only teens with depression kill themselves. Yes, this one is also fiction. Depression is one of the mental health conditions that's associated with suicide. It's the one that we, most commonly think of, and that is a strong association for sure. But there are several other mental health conditions that can be associated with suicide, and sometimes there'll be kids where those mental health conditions might not even apply. They might not necessarily meet a diagnosis, but there could be something that happens, and teens can be impulsive. And so that's something to be aware of, is even if a child or a teen is not necessarily depressed, we still always want to be asking these questions and assessing this and communicating about it. And lastly, most suicidal teens ask for help with their problems. Okay, we've got some differing answers here. So this one actually is fact. So this one is true. They might not directly ask about it, saying that this problem is related to, thoughts of suicide, but it is a fact that they typically ask for some sort of help. And it may not always be in the most effective way, right? Our teens are working on their communication skills as well. And we'll talk about this more, about how parents can respond and check in with their kids about different mental health problems, kind of get ahead of things. Okay, so thank you everybody for participating in our first slide. And I'm going to turn it over to Mallory to continue our presentation.
So we wanted to start off just by talking about what are some of the risk factors, who are some of the teens who might be at a greater risk for having thoughts of suicide or for making an attempt of suicide. And the first thing we want to point out is not everybody is at risk. There are some things that make people more likely than others. And sometimes those risk factors are things that we can't see. They're not visible, or we don't know they're there, but they still exist for that person. So a few of the things that stand out in the research as things that are most highly associated with suicidal behavior are a prior suicide attempt first. So just like Lauren just talked about in that fact or fiction, a teen who has been suicidal and shows improvement, that doesn't necessarily mean the most dangerous time has passed. That teen might have a higher likelihood actually of engaging in more suicidal behavior in the future, both in terms of having made a prior attempt and in terms of a history of suicidal thoughts. Various mental health disorders are also associated with a greater risk for suicidal behavior. Non-suicidal self-injury or self-harming behaviors is something that we often see that's also associated with suicidal thoughts and suicide attempts. Impulsivity and aggression is another one we see. Impulsivity in particular is often the teens that we work with who have made an attempt or have engaged in some suicidal behaviors have some of those impulsive tendencies. And so teens who have those tendencies that might even show up more as aggression towards others might be more likely to then engage in suicidal behaviors themselves. There's also a literature supporting that teens that identify with a sexual or gender minoritized identity are at a greater risk for suicidal behavior. Peer suicidal behavior and family suicidal behavior are also aspects that are associated with a greater risk. And social isolation, teens who don't feel like they have support, they spend more time alone, that can be a greater risk. Having access to lethal means is one that might seem a bit more obvious if you have access to a firearm or even pills. That can even be things like Tylenol or ibuprofen. Having access to those things makes it more likely that a teen is able to act on the thoughts that they're having. And then a lack of access to healthcare fits in with the piece of being under-resourced and not being able to access providers who might be able to flag some warning signs, might be able to see them, is another factor. Then moving on to the next slide, just to speak a bit more about a few other risk factors that we see. One being substance use. So adolescent years is a time when teens are often beginning to experiment with substances. A lot of teens start to engage in those behaviors. And teens who are engaging in more advanced levels of substance use, like binge drinking or use of harder drugs, that is more likely to be associated with suicidality as well. Another thing that can be a significant risk factor is perfectionism. So there's a statistic here that 50 to 85% of adolescents who have died by suicide were described as perfectionistic. And in particular, this note about socially prescribed perfectionism is something that we often see in teens where they're concerned about making mistakes. They're doubting things that they're doing. They're really critical of themselves. And they often have this perception that other people expect a lot from them. They expect them to be perfect. And I think this is something that we see often in Northern Virginia in particular. We tend to see those tendencies in it being a very high achieving area. And a lot of the schools tend to further that message, or their peers do. And that can be a really big risk factor for teens. And then the last thing we wanted to highlight in terms of certain characteristics about teens that might place them at higher risk is a history of trauma. So there's several forms of trauma that can be associated with a higher suicide risk. Those include sexual, physical, emotional abuse, or neglect as a kid. It also includes dating violence as teens begin to engage in more romantic relationships or start dating or have those types of interests during their teen years. Experiencing violence in those relationships can place them at greater risk. Experiencing discrimination related to their identities. This goes in line with what we were saying about LGBTQ plus teens being at greater risk for suicide. And this can also be other forms of discrimination, racial and ethnic discrimination, and based on any other identities that teens might hold. Peer victimization, bullying, being mistreated by their peers is another form of trauma that can increase risk for suicidality. Having a history of sexual assault and any exposure to domestic violence. So trauma in a lot of different domains can be associated with an increased risk for suicide. I'll hand it back to Lauren for a couple of the what can parents do pieces.
We wanted to start off with kind of describing the risk factors associated with suicidal behavior, and then wanted to start talking about what can parents do to decrease the risk for suicide. So we're going to kind of go through 3 different sections here. First, we're going to talk about encouraging self-care. Then we're going to talk about knowing the warning signs. And then we'll talk about practicing active listening and validation to encourage communication with your teen. So first, kind of baseline prevention strategies is encouraging self-care for teens. So that can look a lot of different ways. So that can be emotional self-care, things like social connectedness, making sure that they have friends and like healthy relationships with friends and people that they can rely on. That can also be connectedness to their family, or, broader organizations, siblings, all of that. Making sure that they're engaging in positive and healthy, pleasant events. Right. So we know that that's another really important protective factor, is making sure they're involved in something that they enjoy, whether that's, sports or hobbies or things like that. Making sure that we can reduce unnecessary stress. Right. So being mindful about maybe expectations of the school or of the parents and how that's communicated to the kid, and making sure that we're not, creating unnecessary pressure and stress. And encouraging kids and teens to be kind to themselves. And I think it's also important as parents to be modeling that as well for your child in the way that, you speak about yourself, and kind of encouraging them to speak the same way about themselves. And then from the physical aspect, we know that physical health and mental health are really closely intertwined. And I think it's something that sometimes we overlook, but these things can also increase, a child's vulnerability on a given day is if they haven't really eaten anything, right? Or if they haven't slept well the night before. That's just going to kind of throw off their mood for that day. And that can lead to more impulsive decisions and things like that. So making sure to be mindful of taking care of sleep, right? Taking care of nutrition, making sure that kids are exercising, and then of course, like taking any medications for mental health or other health conditions as well. The next part of prevention strategies is knowing the warning signs. So these are some warning signs that can be kind of earlier on where you might start to notice some concern. So a lot of these first ones we're going to talk about are common symptoms of depression, right? So things like having a lot of negative talk about themselves, complaining that they're a bad person. It could be a change in eating habits, eating more or eating less than usual. And associated with that, right, significant weight loss or weight gain. Can be frequent complaints of physical symptoms as well, like a lot of stomach aches, headaches, that types of thing. Loss of interest in things that they used to enjoy, right? Maybe activities that they've really enjoyed for a long time and suddenly they don't want to do them anymore, don't want to engage, right? Could be persistent boredom, right? That kind of like really low mood, just kind of persisting, or difficulty concentrating as well. Like if they used to be really great at school and all of a sudden it seems like they can't concentrate or they can't, stay in the conversation with you, that's something to be mindful of as well. It's not just about sadness or depression though, like we mentioned, that is one of the risk factors, but we want to talk about some other things to look for as well. So that can be things like acting out, right? Truancy, right? Not going to school, running away, things like alcohol and drug use, declines in grades, neglecting their personal appearance, their personality seeming to change, signs of psychosis, so it's the more severe mental health difficulties where they're saying that they're seeing or hearing things, hallucinations and delusions, not able to kind of tolerate praise or reward. And then the one we mentioned before of being suddenly cheerful after a period of depression is also a warning sign to keep in mind. I want to go a little bit deeper into a few of these. So just think about like what's typical for adolescents versus what's a cause for concern, because a lot of these things are somewhat typical things that can happen with adolescents, right? Something like increased moodiness is typical for adolescents. We expect that, right? But if they're having really like painful, long-lasting moods, and if their behavior is all very mood dependent and risky, and it's getting to that place where it's more of a major depression, or if they're having severe anxiety, panic attacks, if they are, having self-harm or suicidal thinking, then those are all kind of our cause for concern. Next is it's typical that adolescents have some increased self-consciousness and kind of focus on body image, right? What's not typical is social phobia, withdrawal, right? That perfectionism that we talked about, really unrealistic standards, and then eating behavior like restricting, binging, purging, and also being obsessive or neglectful of hygiene. Something else that's typical is increased parent-adolescent conflict, right? What's not typical is like significant verbal or physical aggression or running away. Something that's typical is experimentation with drugs and alcohol. What's not typical is more significant levels of substance use, selling drugs, having like their whole peer group be substance using, using at larger, more regular rates, and that would be more of the cause for concern. Next is it's typical that teens often have stressful transitions to middle or high school. We know that that's a time that's typically stressful. But if it's getting to the point where they're refusing to go to school, if they're bullying other kids or being bullied, right? If they really don't have any connection to the school or to their peers, or if they're failing or dropping out of school, those are definitely causes for concern. Something else that's typical is an increased desire for privacy. But what's not typical is very like significant isolation from the family, right? Like teens might want some more time to themselves, but if suddenly they're isolating much more than usual and, don't come out of the room at all, if there's really that breakdown of communication, if you feel like they're hiding things from you or they're lying to you, that's more of a cause for concern. And lastly is sleep cycles often are shifting later in adolescence, and they want to be a night owl, right? Stay up all night, oftentimes on devices, and sleep late on weekends, and that's typical. What is more of a cause for concern is if they're up all night and sleeping almost all day on weekends, and if that sleep schedule is affecting things, right? Like they're routinely late or missing school, or other activities, things like that. Okay, and I think Mallory can.
Yeah, so now we want to talk a little bit about that last piece where we mentioned the third part of prevention that we're highlighting being active listening, validation. So how do I talk to my team if I'm concerned about them? And if you don't mind, yeah, that next slide, I would love to, if people don't mind, just throwing some things in the chat about how would you define validation? What does that mean to you? No wrong guesses. Yeah, saying you understand someone's feelings, listening to someone's feelings, not always about praise, okay? Seeing their point of view. Yeah, great. So the definition of validation that we use is that validation communicates to another person that their feelings, their thoughts, their actions make sense and that they are understandable to you in a particular situation. So, yeah, I see some of those pieces like relating, seeing their point of view, trying to see that you understand. And something we want to highlight here is that validation does not equal agreement. There is this pressure that lots of parents talk about to both make sure that you're able to listen to your kid and also be trying to lead them on the right path, to give them advice, keep them doing the right thing. And what we want to point out is that validation doesn't necessarily mean that you agree with what they are doing. You might have advice for them, you might have rules for them, and you might still be able to understand how they're feeling in a situation. So some pointers for ways that you can listen actively and be validating are to stay focused on your team. So it's real easy to get distracted by things. Often we all have our phones on us most of the time. It's easy to get distracted by that. There's a lot of folks have multiple kids, or there's just a lot going on. And something that can help teens feel like they're being actively listened to, and like you're trying to understand, is staying focused. And while you're doing that, being mindful of your responses. So being mindful that you're engaged and that you're not engaging in some of those nonverbal reactions like sighing, or even some of those verbal things like, oh, don't be sad. Oh, I don't want you to be upset, which can be natural and come from a place that is intending to encourage them, and can sometimes be experienced by teens as invalidating. Something that can be helpful to express that you do understand is just reflecting back what you hear. So you don't have to add necessarily your interpretation or your advice, but just saying like, okay, what I'm hearing you saying is that this person really hurt you, or you're really frustrated by your curfew or by XYZ. Again, that doesn't mean you agree, doesn't mean you change whatever it is. It just means you're saying you understand it. Another thing that could be helpful in your reflections is labeling some of the emotions, a time when teens might be learning more and more complex emotions, and it can be really helpful for them to learn some of the vocabulary around what they're feeling. And another thing that can be helpful is asking what they need. So a lot of the times people jump into advice giving. It's a common habit that a lot of us have. And sometimes that's what teens want, and sometimes it isn't. So it can be helpful to ask, what do you need? Do you want me to just listen? Do you want me to help you problem solve? Do you want some advice? And to give them some control over how you respond in that situation. The other thing we want to mention here, when we think about validation, because a lot of folks mention that their teens aren't really talking to them. Like we said, it's a time of increased parent-adolescent conflict. It can be harder to have those deep conversations. They might be a little more resistant to it. And one way that you can convey that maybe you're understanding towards an experience that they might not even be sharing with you is in how you talk about other people with mental health related concerns, or people who are going through a difficult time. So speaking about those people in a non-judgmental or validating way, and communicating that you have empathy, that you're concerned for them. And also really important, like Lauren mentioned earlier, to consider how you talk about yourself too. Do you model taking care of yourself when you're stressed, when you're feeling down? Do you model that it's okay to ask for help? And just being conscious that the things that you communicate about yourself and about other people are things that your teen might be able to take away, and know that maybe you understand them too, and maybe you're a safe person that they can open up to. So these are some ways to both talk to your teen when they do open up, and to just maybe set that groundwork that might help them feel more comfortable too, if they're a little more closed off. And then we wanted to talk about, what would you do if you need to take immediate action? So when do you know that you need to take immediate action and you need to get your teen help? Some of those things, and any of the warning signs would be, we're going to list like 3 major ones, but any of them would be a reason to check in with your teen and get help. So any of the ones that Lauren mentioned earlier, you probably want to check in, but there's some that might indicate that you really need to take steps immediately to get them help. So the first here is if they are talking about or making plans for suicide. So that might be that they're telling you this, or it might be that you observe, or somebody else observes, that they're writing about it, they're drawing pictures about it, they're posting on social media about it, or putting affairs in order. So they might be writing notes, they might be giving things away, doing things that might be preparing themselves to take action. Stockpiling medications, doing research on the internet about ways to complete suicide are often things that behaviors they'll engage in before they make an attempt. Another urgent sign that it might be time to seek help is if they are expressing hopelessness about the future. Some of those verbal cues of it's not even worth it, things are never going to change, or more direct things like I won't be around much longer, I won't be a problem much longer. Those would be things that would indicate that they need immediate help. And then displaying really severe or overwhelming emotional pain or distress. So really difficulty calming down, feeling like they are just unable to stop crying, for example, or just really overwhelmed. So those 3 things are major warning signs you want to look out for, and in partner with some other things that you might observe in terms of their behavior and changes in their behavior that might also be really concerning. So some of those behavioral changes you might look out for are being more withdrawn. So withdrawing from their friends, their family, or activities that they used to do. And you're noticing that that's a change from how they've typically been. Changes in their sleep, either that they seem to be sleeping a lot more often or a lot longer, or that they're not sleeping very much and they're staying up really late or up really early. Increases in anger or hostility that seem out of character, seem out of context. You're not sure why they're so upset, so angry at this situation. And similarly, being really irritable or agitated, noticing these things. And like we mentioned earlier, another sign can be after a period of depression, seeming suddenly cheerful. We do see that teens, once they've set their intention to move forward with a plan, that sometimes that will lift the weight that they've been feeling, and we see them appear a little bit more cheerful. So that can be an imminent warning sign as well that would constitute taking immediate action. And then what are the things you can do if you notice any of these really imminent warning signs? The first thing is to always take warning signs seriously. So to always do the act of getting immediate help if you notice any of these things. Always take them seriously. The next is to ask your teen if they're okay and whether they're having thoughts of suicide. As we mentioned at the very beginning, the research shows that asking directly about suicide does not plant the idea in their head, does not increase the chances of them having suicidal thoughts or behaviors. It is actually helpful to ask them. Expressing concern about what you're observing, and this might be labeling what you're observing. So I've noticed that you've been spending a lot more time in your room, Or I've noticed you haven't wanted to go out with your friends. I've noticed that you've been more easily upset lately. Labeling those things and explaining your concern, using those active listening and validation skills that we just discussed, that includes reflecting on what the teen shares, letting them know that you understand and you heard them, telling them they're not alone, that you're here to support them, and then immediately seeking help for them. Even if it's after hours, if it's late at night, there is always resources available for you to contact. And with that, some of the ways that you could be prepared for this possibility would be to know who you would contact and at what times you could contact them. So this could include writing down or having phone numbers of professionals who can help in your cell phone. And we'll have a list of people at the end of this presentation as well, that you can contact, that includes 24-hour suicide hotlines, 24-hour crisis centers, the local ERs. You can always call 911. To familiarize yourself if your child is seeing a provider, a mental health provider, or has a doctor that they've opened up to about some of their mental health related concerns, you might want to know, what are their after hour policies? Can you contact them in case of an emergency? Or can you contact them later after you've called 911? So knowing what are their policies. And then in terms of seeking help apart from those calling 911 or accessing immediate services, in looking for a therapist and someone for them to continue to process with and ensure that they are safe, knowing how to find one who has expertise in treating suicidal thoughts and behavior. And yes, Robin, thanks for throwing that 988 number. That is the suicide hotline, suicide crisis hotline in the chat. The other thing that we ask parents to do, recommend that parents do to ensure their kids' immediate safety if they see some of these imminent warning signs, is to remove or lock up any means of suicide in the home. So that includes firearms, that includes all medications. Like I said, that even includes Motrin, Tylenol, any sorts of pills, razors, knives, anything that is sharp in general. And a lot of the time, teens are taking medications, either for mental health related concerns or other health related concerns. And they might be in that process of gaining some more autonomy and learning how to give themselves those medications. In those cases, when teens are also showing signs of risk, we encourage that parents start managing those medications, and that when they do, they make sure the teen has swallowed the pills. Because teens could stockpile them, could hide them in their cheek, save them for later, those types of things. So making sure that they've been swallowed. And again, noting that these things don't have to be permanent, but they should be in place until the teen has shown improvements and has the adequate supports that they need. And ideally at the recommendation of a mental health provider who believes that they are in a place where it would be appropriate to remove these measures. And then also, in terms of ways to support your teen, creating a monitoring plan. So it's important when a teen is in this state to make sure that they're not home alone and to have ways to check in, especially if you know that there's certain things that are stressful for them, like if they have really severe anxiety about tests and they had a big test that day, checking in with them at those times, or if you notice any warning signs, like they didn't want to hang out with a friend after school, and typically they would. If you start to notice some of those things, just continuing to check in. And maintaining some of those strategies that can support your teen. So attending therapy and doctor's appointments, encouraging them to attend, avoiding heated arguments as much as possible. This also includes seeking your own mental health support or couples counseling or whatever it is that you need to be able to support yourself so that you can support your teen. And then always protecting teens from encounters with individuals who have been abusive, have been neglectful, and caused that sort of traumatic stress for them in their lives. And we wanted to mention a bit here that it's not uncommon that teens feel uncomfortable talking about suicide, even after they've disclosed a plan, they've disclosed that they have some suicidal thoughts, still they might not feel comfortable talking more in depth, or the idea of having these check-ins where their parent asks them multiple times a day how they're feeling and if they're having thoughts of suicide feels really uncomfortable for them. It feels awkward. And ideally, we want teens to start feeling more comfortable with it. We want them to practice it so that they can get more comfortable with that and be able to open up and ask for support. But our first priority is keeping them safe. So, some tricks you can use, some creative ideas, if you're trying to find ways to communicate about safety, but your teen is pretty hesitant to open up, is establishing some safe words or phrases or finding nonverbal ways to check in. So, for example, you might have established with your teen that if you're worried about them, you're noticing some warning signs, you might say, like, do you want pizza for lunch tomorrow? And they can say yes if they are not feeling safe. They can say no if they are feeling safe. And that can also be helpful for check-ins in public, or if your teen is out and you're texting or something like that. So that if they feel self-conscious about others knowing, you have maybe a code language that you can use that allows for a check-in at any time, anywhere. And it could also be, like I said, nonverbal. So even a thumbs up, a middle, a down, those types of things can be useful as well.
So we are gonna wrap up with just talking a little bit about what parents should look for in a mental health provider if their child has expressed some of these warning signs or, directly expressed thoughts of suicide. So we typically say that people should look for evidence-based treatment, right? For research-based therapy and medications and treatment like that for youth with suicide risk. What does that mean, right? How can you tell if a provider offers this evidence-based care? So here are some things that these types of providers would typically do. So first would be following best practices in suicide risk assessments, and I'll talk a little bit more about that in a moment. Next would be obtaining a thorough medical and mental health history when they start working with you and your teen. Developing a suicide safety plan with both the teen and the parent and making sure that the parent is involved as well. Relying on research-based treatments and that they're able to kind of talk about that and share that with you and that you're aware of what that treatment is that you're engaging in. Consistently involving the parents and initiating collaboration with other providers as well. So if this was like a therapist, then having a therapist who's working also with the psychiatrist, the pediatrician, school counselors, things like that. So a little bit more about what the best practices look like in suicide risk assessment. So if you're working with a therapist and they are doing this type of risk assessment, they should be asking information about the intensity, frequency, and duration of suicidal thoughts. They should be asking about the triggers or precipitants of suicidal thoughts, about the intent to act on them, asking about reasons for living as well, asking about methods, including whether the teen thinks that this is something that would kill themselves or how lethal they think it is. Asking about the expected outcome. So like I mentioned, if they think this would kill themselves, asking about the detail of planning that they're going to, right? Is it like they've, maybe just thought like, oh, it could be this? Are they doing a lot of research, right? Or is it something that they're writing out goodbye letters and doing more of that planning of affairs? Information about intoxication, information about was the underlying goal achieved, right? What was the goal of this attempt or self-harm, and kind of like what was the underlying goal there? And then asking about not just about what the suicidal thoughts are looking like now, but sort of the lifetime history of that for the teen, and about the behavior as well. And then also asking about family members and family history of suicide, because we know that's an important risk factor to be mindful of. So a mental health provider should also help develop a safety plan with the teen and parent. Like we mentioned, this is an example of what that might look like. So there's lots of different formats of this, lots of different worksheets and ways that we do this with teens and parents. But what that usually involves is talking about how to remove access to means. So making the environment safe, right? Locking up sharps, things like that. warning signs and vulnerabilities. And so that can be different for every teen. And we typically talk with a teen about that. Like, what does that look like for you? For some kids, it's more sadness, right? That triggers those thoughts of suicide. For some, it's more anger or anxiety even. Then we're going to talk about things that you can do on your own, right? That the child can do, the teen can do on their own, people that can help distract them, the adults they can ask for help, and the phone calls. So that is what the safety plan would look like. What if your kid doesn't want to talk? We talked a little bit about this already, right? And this is important in safety planning as well. And so with the provider, you can kind of come up with a detailed plan, but then also figure out maybe a simpler way to communicate about safety. So I did this earlier today. I created a color-coded safety plan with a teen and a parent because this teen wasn't really just ready yet to talk about, this is what I'm thinking, these are the thoughts, but they were open to just sharing some colors, and we have sort of a plan in place for each color. And so that just allows them to say where they're at and helps the parents or the providers to determine safety levels. So this is something that I've done as a therapist in therapy as well, is like kind of checking in on the colors each week with clients. And so this is just a quick example of what that could look like, and just kind of where's your safety level, what are those signs, and then kind of what are the supports that you need at each level. And a couple other ways to assess if they're using research-based practices, right? Do they have explicit training? You can ask that question. Can they speak intelligently about the treatment plan? Do they begin with assessing suicidality each time? Do they ask about stressors over the week? Do they teach new skills? Do they assign practice assignments or homework between sessions? They know when to refer to a higher level of care? Do they involve you in therapy as a parent? And do they ask for your observations of your teen, right? Providing updates and involve you in safety planning. Some red flags to look out for in providers is if they're not licensed, or if they're not practicing under the supervision of a licensed provider. If they claim to have knowledge that no one else has to best treat your child. If they're promising like immediate dramatic results, right? If they refuse to involve caregivers in the treatment process, especially around safety. If they don't share the results of assessments that they do. If they claim that therapy is going to take years and years for progress, when we actually know that there are a lot of evidence-based treatments that can show progress within months for teens, and that they encourage continued participation in the same type of treatment when no sign of progress is made over a reasonable amount of time to expect change, right? And it's different for everyone, but if months or years are going by and there's really not anything changing, and they're continuing to encourage that your teen continue that therapy, that's also a red flag. So that is kind of the end of the content. We have a few more slides just with resources, so I'm going to go through those really quickly, but not talk too much about those, because I know we wanted to save a few minutes for questions at the end. But the resources we have here are websites to help identify evidence-based therapists, more information about what the evidence-based treatments are for children and adolescents for different concerns. This is more information with a video series that's really helpful. More resources here, and immediate 24-hour resources, including the 998 number and other crisis resources. And we wanted to wrap up again with our skills group, and that's going to be distributed as well, so that more information is there. And that is all that we had to share for today. Thank you so much, everyone, for being here and listening and participating in the chat. We will be distributing those copies of the slides and the video of the workshop as well, but wanted to open it up now for any questions that folks have.
So I did just have a question, and I know this particular presentation focused a lot more on maybe our teens, but I have a 12-year-old. Is a lot of this, how young is too young, right? I guess is the question. Like, how young is, there's a lot happening, we're puberty, we're hormones, we're all this stuff, like, and a lot of it is resonating, but at the same time, a lot of it is just normal chaos of being a 12-year-old. So how young is too young to really start taking a vested interest in how they're feeling? Or is there a too young?
I would say there's not a too young. I'm currently working on a child psychiatric unit, and then Mallory's on the adolescent side. So we go up to age 13. So that means everybody that I work with is 13 and below. And unfortunately, we know that kids can have suicidal thoughts and make suicide attempts at 12 and at younger ages as well. And I think it's just kind of keeping in mind like what's maybe developmentally appropriate of how to talk about it at each age, right? So with a 5-year-old, maybe you're not asking as directly, or maybe you're, coming up with more of those safe words or ways to talk about it. But it is important to keep in mind that, yeah, this risk can kind of go across the age span, unfortunately, and it can be helpful to keep those warning signs in mind. And if there are a lot of warning signs, consulting with a therapist about how best to address that.
I don't have any questions really per se, but thank you for doing this. I think it's really important. You guys touched on some stuff that I never even thought about. And I think it's super beneficial. And I love this kind of dialogue. I think it's super important, not just for kids, but for adults too, because I have plenty of adults in my life who could benefit from sitting and listening to this, you know? Um, the only thing I want to touch on, and I hope it's appropriate to say here, with when my nephew died, we had zero signs, no signs at all. He was happy-go-lucky kid who, from what we could tell, had no signs of any distress in his life. And he took his life, from what we know from the notes he left behind, it was his first love broke up with him, like in a text message, and then there was no more contact. And he just decided in that moment of grief that he didn't want to live anymore. And so, one thing that I really try to impress upon people is it can happen to anyone at any time for any reason. And so I think what's really, and that's scary. It's very scary for people to hear that story, because then it's like, well, wait a minute, there's supposed to be signs. So my big thing that I like to impress upon everybody is communication is so important. I have a 6-year-old, and so I try very hard to validate you're a human being with emotions and feelings, and everything that you have to say is important to me. Um, and give her coping skills for how to handle her upset. I'm sorry that you can't watch TV anymore. We're not going to throw the remote across the room. Things like that. Like just trying to help her understand the best ways to communicate how she's feeling, and that I'll listen to anything. So thank you again for doing this.
Yeah, thanks for sharing. And I really appreciate you highlighting some of those pieces, because I think it is important to recognize that there's not always those signs. And that's part of why we wanted to spend some time focusing on active listening communication, for exactly the reason you said, is if you're worried and you don't necessarily have the signs, your kid's not talking about it, that's at least one thing you can do preventatively, right? And still is not going to guarantee safety, which, like you said, is terrifying, and it's something you can do, right? And
There's
I
a
thought,
question in the chat. Sorry. It says, maybe I missed it, but what do you do when your child doesn't want to even go see a therapist? My kid says she won't speak to a stranger. How do I convince her it's in her best interest?
yeah, this can be a really tricky situation. And it can be really tough. It's weird. It's uncomfortable to open up to a stranger. Especially for some kids, they really are anxious in talking to people, or they feel just maybe really uncomfortable talking about these things in general. It's weird. And I think validating that can be really important. And I think that your level of concern is really important as well. If you see some of these warning signs and you have those levels of concerns, it might be, it is worth fighting the battle, taking them there. And, they might not talk. That happens. We see kids who sit in a therapy room, barely say anything. And sometimes they warm up, sometimes they stay a little quiet, but we hope that they can find a connection with someone. But Lauren or Robin, anything you would add?
I just want to add that one of the other resources we haven't highlighted as much in this talk is your pediatrician. You know, Virginia is one of those states where pediatricians have immediate access to talk to a therapist or a child psychiatrist to help your child, you know. So often, if you can get your child to the pediatrician, they may be able to talk to your child about, talking with a therapist. And a lot more of the practices in the area now have therapists within the practice. Our goal here in Virginia is to have therapists in every pediatric practice. We're not there, we're not even close. But so that would be also my suggestion is use your pediatrician as a resource. My other little tip, and I know Mallory and Lauren may have different ideas, is I will tell a teen, give it 3 sessions. It's kind of my 3 strikes and you're out rule, that like a baseball rule. Um, and so as a parent, you can say to your teen, I'm asking you to commit to meeting with this person 3 times. The first time is super awkward. It's awkward for everybody. No one knows what to expect, it's kind of weird. The second time, you start to get a sense of what it's going to be like, whether you're going to connect. By the third time, there's either a connection, and again, we train our therapists to say it's your responsibility to build this connection, the therapist's responsibility, not the child's. But by the end of the third session, if we're not accomplishing anything, we're not connecting, we'll advocate with your parent to not have you continue this therapy at this time. And in many, many, many years, way too many at this point, I have had one teenager take me up on that. So, and she participated. She was like, I'm not interested in therapy, but I'll participate for your 3 sessions and then I'm out of here. And she was, but again, hundreds of others. If you can get them in those 3 sessions and make sure that the therapist is a good match, it makes a huge difference. So, okay, that was my last pearls of wisdom.
Well, I just wanted to say thank you, ladies, again so much for taking the time tonight to put this on and all of your hard work putting together this presentation. Um, it was really insightful, actually. Like, as much as I've heard quite a bit of this information, there's always something new. There's always another takeaway. There's always another pearl. So I appreciate it so much. Again, we will be sending out copies of the slides so you can have all these resource clicks available to you. And we will put the video of the presentation up on GMU's website and our website. And if you're interested, we've got 2 more this fall. We've got October 16th. From Stress to Strength, which is handling anxiety, a little bit about talking about anxiety and tackling that, which will be interesting for me. And then on November 20th, Holidays Missing Your Loved One, because, it's just hard for those that get left behind, right? So we're looking forward to those. And again, thank you guys so, so much. Lauren and Robin and Mallory, you guys are amazing, and we appreciate you so much.
Amen.
Thank you so much for having us.
Yeah, thank you.
All right, let's have a good night, everybody. Thank you.
Thanks, everybody, for joining.